I have a 65-year-old woman with breast cancer and metastatic brain tumor. She was doing well with no symptoms at our last visit. Follow up every 3 months with a scan. With an MRI scan with and without contrast. Managed Medicare that she's on reviewed the case and denied it. They said she had no symptoms at the visit. There was no reason for her to need a scan. So what did we do? Dr. Landolfi got on the phone. He went through the reasons why we do the scans every 3 months. Usually we start 2 months, 3 months, 6 months. We usually don't go past 6 months. Some people go to a year. We sometimes do go to a year. They just didn't see our point of doing it. They only allowed for us to do a with contrast scan. We couldn't do it without contrast. So they really limited the care that we wanted to give, because as most of you know that are going through this process, we compare many slices of the scan. We look at with and without. So to us it was a little devastating that the person on the other end of the phone, who wasn't a neuro-oncologist, was telling us no, that this is an acceptable practice. The other thing that I want to mention, just because a lot of times when tumors do come back, anyone ever have a PET scan done? Or a SPECT scan? SPECT scans are part of the MRI. They look at the different enzymes. They usually are not covered by insurance. So a SPECT scan usually charges over $1,000. And a lot of times when you're going in and signing all those papers at registration, they're going to have you sign saying that your insurance company might not pay this, but you're signing off. And at that time, most of the time people don't read the fine print, that you're saying that you're going to be responsible for that $1,000. So make sure if you ever have to have a SPECT scan that you're signing off on that. It's considered not FDA approved or experimental by Medicare. So most commercial insurances will follow that Medicare ruling. So if you ever need a SPECT scan, so a lot of times we won't order a SPECT scan, we'll order a PET scan. Well, now we're running into the same problem with the PET scan. And PET scans, what we use them for those that don't know, is we use them to look at, is this tumor growth or is it radiation necrosis or dead tissue from the treatment that you've had. So the PET scans now we're running into the same problem. Medicare especially will not pay for them up front, and especially if you had it for the same diagnosis within a 6-month period. So there's something called NOPR, which is the National Oncological PET Scan Registration, and it's NOPR. So if you ever need a PET scan, make sure you know those words. Make sure your facility's registered. Not every facility, my facility wasn't registered, and in the last year they had to register because they had no choice because of payment. So what was happening was, now that they're you have to fill out paperwork. So I get paperwork beforehand that I have to fill out about why we need it, and then paperwork afterwards. And you have to fill that out for the facility to get payment for that PET scan. Because then what they do is they look at the impact of the PET scans and how they're affecting outcomes, or what treatment might be needed, and they're looking at, was it worth it or not worth it, and then they're looking at, yes, we'll pay for the scan. So most places, or a lot of places that I work with now, I have to fill out this paperwork for it.